About 100 people showed up to a groundbreaking ceremony for Washington County's new receiving center on Friday. Located next door to the DMV licensing building in Hurricane, the new site is a central location for law enforcement from 5 counties to bring those who may need mental health during crises, as well as those walk-ins who may need immediate support.
And they can just be here for a day or a few days, just till the crisis is resolved. They'll do an evaluation with a counselor who can talk to them, and then we'll have peer support people that will give them options and talk about plans for what they can do in the future.
Key stakeholders were invited to turn over 20 gold shovels where the new 24-hour crisis center will soon be located.
This receiving center, for me, is really going to be a building that will offer hope. It'll offer hope to families that find themselves in crisis. It'll also offer a valuable tool to our law enforcement agencies as they are out there interacting with the public and they find individuals who are in need of crisis or in crisis, in need of help. And right now, the only option they have is to take them down to the county jail.
Look, for far too long, we've been asking our law enforcement officers to do things that is not their responsibility. We've put them in terrible situations, and they've always responded. They always do, and they always will, and they always do the right thing. But it's not fair to them, it's not fair to their families, and it's not the best thing for our society. And that's why this is so important.
Currently, we're working on a medical expansion that'll add about 60 more medical beds. And then in combination with a receiving center, that'll give us a couple of options to help free up some of those beds and get people the treatment they need.
So it's a resource for the 5 Southwest counties. I've talked to all the sheriffs. They're really looking forward to utilizing it, and as well as the police chiefs in the cities within those counties.
The unveiling of the project has been long awaited and a collaborative process amongst all who have been involved.
The vision of a not another jail building, no offense, law enforcement, but not a facility that looks like you're going to go stick somebody away somewhere, but a residential, warm reception area. We're very grateful. It's going to look great.
The unique design of the building is not only one of a kind, but also has 2 sides for different needs.
So the footprint of the building is 13,000, a little over 13,000 square feet. It will contain 16 residential rooms for those that need to stay for a little bit longer periods of time. They also have the 23-hour stay, kind of critical care areas, crisis care maybe. They will have recliners for that stay period. And that, anywhere from 10 to 16 recliners, places for those people to stay. Detox room, exam rooms, and then all the clinical support staff that they need to get them on the right track.
You have to have about 4 or 5 people on shift at all times, and that's 24/7. So it will employ people. We'll need medical people, nursing, as well as peer supports and case management and therapists.
It's going to be really helpful for those who are afraid to come to the hospital, that have mental health problems. Maybe they've had a bad prior experience and they're resistant to getting more acute care than just at their outpatient doctor. So it serves a really great need for folks who maybe don't necessarily need to be in the hospital.
It means suicidal, depression. We can also deal with people who are using substances and need some social detoxification, just if people feel like they can't handle things right then.
Yeah, sadly, the suicide rates here in our state are far too high. And the best part about these receiving centers is that we can have professionals who can intervene very quickly and help talk people off of that ledge, help them get the support that they need, and we believe that this will lower suicide rates in our state, and that's a big deal.
Intermountain Hospital also graciously donated $100,000 to this project.
Yes, we're super excited, and this is something that's really important to us, is making sure that we're giving back to the community. So to be able to support this at $100,000 is a small token of something that we can do to help, and we would encourage others in the community to lend their support as well.
Local legislators helped push for state funding for this project based upon past success of a similar program.
I credit Davis County with kind of starting this movement and this policy and showing how they can be so effective. Being that kind of intermediate, it's a little softer, but we've seen so much positive success come out of this model, so I'm really excited for it.
The project could also be especially helpful in decreasing recidivism.
And law enforcement will have a dedicated entrance. Patrol officers can bring someone in, drop them off where they can be getting professional help administered through our Southwest behavioral folks, and help them get the services they need, get in a position where they can then make a plan so they can be seeking out the resources they need. If the person does that and they leave the crisis center and they seek out those resources, we don't anticipate charges being filed on whatever law enforcement got called out to.
While the state helped to provide much of the resources, the county also helped by giving up the land.
We thought of where to put this particular facility, not only central to the county and close to law enforcement for the county, but also the county already had this land tied up. So our donation to the whole cause is not only multifaceted, but this ground as well.
Funding for the project is estimated just under $4 million. Construction will begin after the county fair next month. Watts Construction hopes to have it completed by the end of this year. In Washington County, Melissa Anderson, Community Education News.